All right, so we are recording the class. So first thing I want everybody to do, please, in your chat, just go ahead and type in your name and the email address that you are using to do your lifeguarding class. Aiden, I do need you to turn on your camera for us, please. Thank you. Give everybody a second to get their emails in there and their names. At any point you have any questions during this, feel free to either unmute yourself and let us know. We can give a pause real quick, or also just type something in the chat and we'll be kind of watching that from time to time. Looks like everybody's pretty much put their email addresses in, so we're going to go ahead and begin. Hopefully you've all started your online portion of the lifeguarding class. If you have not, that does need to be done prior to the in-water class. So make sure you are working on that if you haven't already finished it. Perfect. All right, so we are going to go through the virtual skill sets. We're going to talk about the professional lifeguard. Requirements for successful completion of the blended learning course includes attend and participate in all class sessions, complete all units of the learning component, and provide proof of the completion to the instructor. Basically, that means you need to email Corey or myself your certificates. We do need to have that prior to us getting you certified. Demonstrate competency in all required skills and activities. Demonstrate competency in all required final rescue skill scenarios, and correctly answer at least 80% of the questions in each of the 2 sections of the final written exam. If I remember right, we got Drew Baker jumping in. Give him a second. If I remember right, Corey, I think it's the CPR and the lifeguarding that we have to do testing on, right? And it's like 40 questions on the lifeguarding and 25 on the CPR. Is that right?
I think 40 on the CPR and 35 on the lifeguard. Yeah.
Perfect. Drew, I know you just jumped on. Make sure you put your email and your name in the chat for us. And if you haven't yet turned on your camera, make sure you turn your camera on. Being part of a team. The lifeguard team must communicate and work together effectively when responding to emergencies. Effective communication, trust, mutual respect, commitment, and cooperation are crucial elements for working effectively as a team. In your job as a lifeguard, aside from being a team player, while responding to emergencies, what can you do as an individual to have a positive effect on the team? Different things you can do is arriving to work on time. And for me, arriving to work on time, if your shift starts at noon, that doesn't mean you're walking in at noon. You should be there 10 to 15 minutes early. That way you kind of get a feel of what's going on at the pool prior to you get there. And also if there's anything else that needs a little bit of help coming in. Rotating stations on time. And again, if you've ever lifeguarded, one of the biggest frustrations if you're on the stand is anybody coming in 1 or 2 minutes late. Make sure you're always rotating on time. Attending any in-service trainings. Enforcing safety rules in a consistent manner. Communicating clearly while treating others with respect, being prepared by maintaining knowledge, skills, and physical fitness, completing secondary responsibilities in a timely and acceptable fashion. As far as enforcing the rules, that's really huge. Don't let some kids get away with things and not others. It's always good just to make sure you keep everybody safe in the exact same way you would. As far as completing secondary responsibilities in a timely, acceptable fashion, that could be just picking up towels. It could be cleaning up ladders. It could be cleaning up the pool deck. When I first started guarding, my managers told me if you ever see us doing anything, it's because you're not. So make sure that you are on there and doing something. If you see your manager working on something, Jump in and help as quickly as you can. As lifeguards, you should be given an EAP that guides the actions of lifeguards and other team members in emergencies. The EAP, which that stands for Emergency Action Plan. The EAP describes what needs to be done and who does it in the event of emergency. EAPs are discussed in more detail later on in the course. The lifeguard team is part of the broader facility safety team. The safety team includes management and maintenance staff who provide assistance in maintaining a safe environment and providing emergency care. Local emergency response personnel are also part of the safety team. Talking about facility patron and surveillance, entries and approaches. You guys should have already been watching the entries and approaches. Does anybody have any questions on the videos that you've already seen? And if you do, you can put it in the chat. If not, we'll go on. Next week, we'll do a lot of entries and approaches along with all the rescues. So make sure you're kind of up to date on those. Talking about rescues at or near the surface. What are the different rescue skills that lifeguards use to rescue a victim at or near the surface of the water? They include a reach and assist. That could just be reaching your hand or reaching your leg out to them. A simple assist, again, is holding on to a ladder, just something very easily done. Active victim front rescue, active victim rear rescue, passive victim front rescue and rear rescue, and then multiple victim rescue. And these are all rescues that you should be seeing in your videos right now that you've been working on, and we will be going over next week. What is the purpose of an EAP? Again, those are the emergency action plans. The purpose of the EAP is to describe everyone's responsibility in an emergency. It's always important to know what your job is and what everybody else's job is at the same time. For example, with us, if we have a situation, we make sure that when one guard goes in, the other guard that's on duty is also standing and pointing in that direction. So as other guards come out on deck, they can see where the situation is, where the emergency may be. If you have to call 911, you have somebody directing where the ambulance should be coming in and where they should be going to, and make sure the area is clear. What are some examples of submerged victim rescue skills you saw in the video? You saw a passive submerged rescue victim, the shallow water, and then a submerged victim in deep water. The deep water is always the most difficult. You got to be able to do a feet first surface dive. You need to be able to get down to about 12 to 15 feet deep, depending on the pool you're in. When you're performing a submerged victim rescue, a deep water technique, what technique should lifeguards use to submerge underwater to reach the victim? You're either going to do the feet first surface dive or the head first surface dive. Most of you all know how to do a head first surface dive. The feet first really isn't all that difficult. You're just going to kind of push your body up. And as you go underwater, you're going to take your hands, you're going to push them up in the air, and that will help drive you down to the bottom of the pool. After performing a rescue, what factors should you consider when deciding which extraction technique to use? It's going to be the victim's size, their condition, and the characteristics of the facility, such as are there stairs, moving water, zero depth entry. Some of the pools you do work at, they will have a zero depth entry. That will make it a lot easier to get victims out of the pool because you can take them into that area. If you have a deck that's right at the surface as well, or a gutter system that's right at the surface of the pool, that's also very easy. When you have the raised gutter system, that's what's a little bit more difficult. May take a little bit more time to just try to figure out what you're going to have to do. We'll go over all that stuff though. Again, hopefully you're doing all of the e-learning stuff already. If you haven't, make sure you're getting started. I know I talked to one of the guards the other day and they've already got theirs finished. So that's fantastic. Always make sure with standard precautions. What are the diseases that of a primary concern for you as lifeguard? Hepatitis B, hepatitis C, and HIV. So always make sure you're wearing your protective PPE, your personal protective equipment. That would be a breathing barrier if you're having to do any kind of CPR, or gloves as well. And really in a lot of ways, I would even say glasses, because you don't want any blood if it's coming out, you definitely don't want to get in your eyes. We're not going to practice removing gloves right now. So using your senses, what information can you gather about the scene of an emergency? You can use your sight to look for hazardous conditions, number of victims, number of bystanders. You can use your smell, your nose, for odors that might suggest chemical release, intoxication, diabetic emergency, or burning objects. And then obviously your hearing for any unusual sounds or cries of help or splashing. Why else is the size of the scene necessary? You want to ensure the safety for the rescuer, the victims, and any bystanders. And really, you got to remember, while you're getting ready to rescue somebody, you have to keep yourself safe as well, because if you end up becoming a victim, then it becomes a lot worse. You need to identify necessary PPE. For everybody, it's going to be gloves, at least gloves at the very minimal. Again, if you're using CPR, masks. You should have at your pools, hopefully, your own personal fanny pack. In that fanny pack should have a mask. You should have your own gloves and any other kind of bandage or whatever that you might need on a quick tour around the deck. You need to form an initial impression by looking for signs that may indicate a life-threatening emergency. You need to determine the mechanism of the injury or nature of the illness. You need to determine the number of victims, and you need to identify what additional help may be required. For example, if you see somebody, they dove off the blocks, they come up and they're not really moving, or they're holding their neck, you need to make sure you get a backboard. Somebody's bringing a backboard to you. Determining the number of victims is always important, because if there's 2 or 3, you need to know if you need backup for a multiple victim rescue, right? If they're on deck and they're just down on the ground, you need to make sure there's not any wires hanging around, or if there's any chemicals on the ground. Always make sure you're sizing up the scene before you go any further. When performing a primary assessment is done to identify any life-threatening conditions. The steps include to check the victim for responsiveness using the shout, tap, shout sequence. So you first shout them, are you okay? Then you tap and shout, are you okay? And then you kind of go from there. When checking a child or infant, obtain consent from a parent or guardian before providing care if possible. That if possible is important, because if, most pools you're going to be at, most of the kids, if they're 10 or older, they're probably at the pools by themselves without parents. So anytime where it's a child without a parent, consent is implied. You need to open the victim's airway, check for breathing and a pulse simultaneously. You'll check for the carotid artery pulse in an adult and child, and the brachial pulse in an infant. If the chest does not clearly rise when attempting either of the first 2 ventilations, you need to retilt the head and try to give another 2 ventilations. If after the second attempt, the chest clearly rises, give 1 more ventilation, so there's 2 successful ventilations. If after the second attempt, the chest does not clearly rise, immediately begin CPR. Do not attempt giving more than 3 ventilations total in a row. In general, if a victim is unresponsive but breathing, you do not suspect a head, neck, or spinal injury, place the victim in a side-lying recovery position. So this is if they're on deck. Recovery position should also be used whenever you are alone and need to leave the scene. Example, you need to call for help. So with that being said, like if you're by yourself working on a victim, you work on them for a full minute and then put them in the recovery position on their side to go call for help. Once you come back, you recontinue whatever you were doing. Anybody have any questions on primary assessments? Okay. What types of life-threatening conditions are you looking for during a primary assessment? You're looking to see if the victim is breathing and do they have a pulse? In what situations would you give 2 ventilations during a primary assessment? You'll do that for any victim who is not breathing and has no pulse as a result of a drowning, which is really what most of us at this point, when we're looking at lifeguarding, that's what we'd be looking for. So you'd want to make sure you do the 2 ventilations during that primary assessment. How long do you check for a pulse and breathing during the primary assessment? Does anybody know? Corey knows. 5 to 10 seconds, okay? So you're gonna check no more than 10 seconds, but about 5 to 10 seconds. Well, that would have been really embarrassing if I clicked the next slide and I was wrong. What are the techniques for opening a victim's airway to give ventilations? From the side, you're gonna use the head, tilt, chin. One second, we have a late comment. Give him a second. Hello, Andy Nelson, how are you? Andy, if you can go ahead and turn on your camera and then sign in the chat so I know that you're here. Okay, so what are the techniques for opening victim's airway? From the victim's side, you're going to use the head tilt chin lift from above the victim's head. You're going to tilt the head back using the jaw thrust maneuver. And if the victim is suspected of having a head, neck, or spinal injury, again, you'll go from the head, you'll use the jaw thrust without using the head extension. So in other words, you're not going to tilt the head back if you think they have a head, neck, or spinal injury. Those are all things we'll go over next for 2 weeks. The CPR, we do that, and the in-water stuff. What should you do if your ventilation does not make the victim's chest clearly rise? Anybody know? If you do, put it in the chat. Andy Nelson, make sure you sign into the chat as well. So if the victims, if the ventilation does not go in, we're going to retilt the victim's head and reattempt another ventilation. If the ventilation still doesn't go in, you're going to assume you have an unconscious choking victim. All right, with primary assessments, now we will discuss the elements that are unique when performing the primary assessment for a drowning victim, including when to give ventilations, as well as unique elements when performing the primary assessment on a child, including getting consent, opening the airway, and giving ventilations. Anybody have any questions about the giving ventilations yet? Again, we'll go over these maneuvers, 2 weeks. What other conditions may occur in the aquatic environment that might require summoning EMS personnel? You could have an underwater recovery of a person who may have inhaled too much water, seizures in the water, and suspected or obvious injuries to the head, neck, or spine. Really, out of all these two, the seizures in the water could be the most scary out of all of them, because you may not even realize someone's having a seizure when it first happens. If you have people at your facility that you know are prone to seizures, hopefully the parents have kind of let you know as well. So it kind of gives you an idea of watching that. I know Corey in the past has had a water polo player who had seizures, so that made the coaches a little bit more aware of kind of keeping an extra eye on that sort. I know a few years back at Westboro Country Club, there was a drowning of an adult who had a seizure, and no one knew that he was prone to seizures. So when they first saw him, it appeared as if he was swimming underwater. No one really kind of caught in what was going on right away.
We had a seizure event at Ladue where the student was underwater, and the coach at the time gave 4 cycles of CPR, became conscious, went back unconscious. The coach continued to do CPR. ER doctor said if the coach hadn't done CPR, he would have died.
Wow.
Yeah, so all stemmed from a seizure, and the student was okay afterwards. In fact, 2 days later, I had pizza and chocolate donuts with him. So CPR does work, guys.
Absolutely.
Absolutely works.
Andy Nelson, if you can, I need you to turn on your video. Give him a second here. Andy, if you get a chance, turn on that video. There we go. Then Andy, don't forget to sign into the chat. All right, when moving a victim needlessly or improperly can lead to further pain and injury. Really, you shouldn't move a victim. If they're on a pool deck, unless there's something dangerous, leave them where they are and address what you can right there if you can. What factors should be considered when deciding whether or not to move a victim? You are faced with an immediate danger. So either you become in danger or that victim seems to become in danger. You need to get to other victims who have more serious injuries or illnesses. You need to provide appropriate care. Example, moving a victim to the top or bottom of a flight of stairs to perform CPR. If you must leave a scene to ensure your personal safety, you should make reasonable attempts to move the victim to safety as well. So, if something's happening, the storm's coming on, there's a fire coming on, whatever that could be, you want to take your victim with you as best you can. If you move a victim, what factors should you consider deciding what method to use? You're going to decide based on their height and weight, your own physical strength, obstacles you may come upon, such as stairs or narrow passages, the distance to where you're trying to get them to, availability of other people who can assist you, the victim's condition, and availability or access to aids to transport or move the victim. Recognizing and caring for breathing emergencies. There are two types of breathing emergencies, also referred as respiratory. There's respiratory distress, which is a condition in which breathing becomes difficult. And then there's respiratory arrest, which is a condition in which breathing stops. Respiratory distress may lead to respiratory arrest. And if you think someone's in distress and they're just having trouble breathing, you still want to make sure that you are, number one, with them, because you want to maintain the idea of knowing that they're still breathing. And if they seem to become in major distress and they're not apparent, I would definitely be calling 911 and get EAP rolling as quickly as you can. What are some signs and symptoms of a person in respiratory distress? They could have slow or rapid breathing. They could have usually deep or shallow breathing, shortness of breath or noisy breathing, dizziness, drowsiness, or lightheadedness, changes in level of consciousness. If you see LOC, that will always stand for level of consciousness. If they have an increased heart rate, or if they have chest pain or discomfort. There are also other signs. Our skin is flushed, pale, or ashen, or bluish, usually cool or moist skin, gasping for breath, wheezing or gurgling or high-pitched noises, the inability to speak in full sentences, tingling in the hands, feet, or lips, feelings of fear or apprehension. It may just be anxiety. Giving ventilations. What are the differences to be aware of when giving ventilations to a child? When you're opening a child's airway, make sure you tilt the head slightly past the neutral position, but not as far as you would for an adult. When giving ventilations for a child, you're going to give them one for every 3 seconds. When you're doing ventilations, the ventilations are such that you're not doing CPR. So you have a victim that is not breathing, but they have a pulse, and that would be when you're doing ventilations. What are the differences to be aware of when you're giving ventilations to an infant? You're always going to be using a pediatric mask if you have it. If you don't, turn your adult mask upside down so that the nose is on their chin and then the bottom of the mask is across their nose. When you're opening an infant's airway, keep that in a neutral position, so don't tilt that head at all. And again, you're doing one ventilation for every 3 seconds. If you're doing ventilations on an adult, that's one breath for every 5 seconds. And there you'll tilt that head back a little bit further. Bag valve mask, and we'll go over that in 2 weeks. Those are very easy. You need at least 2 people to do that, one to seal the mask, the other to squeeze the mask, or to squeeze the valve, the bag. All right, airway obstruction. What are most common cause of respiratory emergencies? You have an airway obstruction. What are mechanical and anatomical obstructions? So mechanical obstruction could result from a foreign body lodged in the airway, generally food or other small objects. Anatomical obstructions are caused mostly by the tongue. When a person becomes unconscious, the tongue loses muscle tone and falls back, blocking the airway. Those are both things you got to be aware of. Especially again around country clubs. If any of you are working country clubs or pools that they have snack bars around, kids run around all the time with food in their mouth and they're jumping in the pool, not really paying attention. We had one of the guys that Corey and I have worked with before, Kevin Brennan, out at Forest Hills. They had a child the other couple of years ago, jumped off the diving board with a hot dog in their mouth, and she had actually swallowed the hot dog while underwater. They went down to get her, and they didn't realize she was choking. They thought she had drowned at first. Thankfully, it ended up just being a choking experience, and they were able to get that taken care of. But always be aware that there could be something around where you are. For abdominal thrust, we're not going to worry about showing you how to do it, but just keep in mind, you'll stand with one foot in front of the other with knees bent for balance and stability. With one or two fingers, you're going to bind the navel. You're going to make a fist with your other hand, place the thumb side of your fist against the middle of your abdomen, just above the navel. Then you're going to cover your fist with the other hand, and you're going to pull upward, inward, and upward to give it an abdominal thrust. Make sure when you're doing this on people, when we do that next, or in 2, I keep want to say next week, in 2 weeks, you're not using full force, right? It's just an idea of showing us that you know where it needs to go. But abdominal thrusts work wonderfully. I've actually had it done on me. I choked on ice a couple years back. When I say a couple, I think I was 13. But it came out of the third one. I've done back blows on people, and that's also worked great. Be sure to make each thrust a distinct attempt to dislodge the object. The other thing to make sure when you're doing obstructed airways for adults, especially adults, because they're going to be closer to your size, always turn your head to the side when you're doing abdominal thrust, because you don't want their head to come back into your nose, right? So make sure you keep yourself stable. When you're doing back blows, you're going to stand behind the patient with one foot in front of the other for balance and stability. You're going to place one hand across your chest and grab their shoulder. You're going to then have them lean forward as parallel to the floor, and you're going to demonstrate back blows, right? Remember, when you're showing us, you're not going to be doing them full force. You're just going to say back blow, just nice taps. And then you'll stand up, outstretched with one arm, palm facing up. Oh, we are not going to do that. And you'll do it about 6 to 10 inches away. Make each blow separate and distinct attempt to dislodge the object. Back blows are great. Cardiac emergencies and using an AED. AEDs, when we talk about AEDs, I always tell everybody they're really kind of idiot proof. You open them up, you turn them on, they tell you what to do. All you have to do is listen. What are some signs of cardiac arrest? Maybe a sudden collapse, unresponsiveness, no normal breathing, and no pulse. What is the difference between a heart attack and cardiac arrest? A heart attack occurs when the heart muscle experiences a loss of oxygenated blood. Cardiac arrest occurs when the heart stops beating or the heart is beating too irregularly to weakly circulate the blood effectively. The victim is unresponsive, does not breathe, and normally has no pulse. A heart attack may cause cardiac arrest. What is CPR? CPR is a combination of chest compressions and ventilations to circulate blood that contains oxygen to the brain and other vital organs of a person whose heart and breathing have stopped. How can you make sure that chest compressions are effective? You need to make sure that the victim is on a firm, flat surface. You need to make sure you're correctly placing your hands for compressions. Compressing the chest in a straight down manner to the proper depth. Performing compressions at the proper rate. Making sure the chest is exposed to ensure that the chest recoils between each compression, minimizing interruptions in CPR. The other thing to keep in mind, if you're ever in a situation doing CPR, make sure you have someone clearing the area where you're around. You don't want onlookers watching over what's going on for a couple of reasons. Number one, you want to give that person who you're doing CPR and give them some kind of decorum and privacy. But the other reason is if you actually clear that area, when EMS arrives, they're going to have a straight shot to get there as quickly as possible. And you don't want to make them have to avoid people. You want to make sure they get right in, right out. Once started, when do you stop CPR? When you notice an obvious sign of life, such as normal breathing. If an AED is ready to analyze the victim's heart or shock. If another trained responder or EMS personnel takes over. If you are alone and too exhausted to continue, or the scene becomes unsafe, Remember, if that scene becomes unsafe, you will need to try to move that victim as best you can if possible. What should you do if at any time you notice normal breathing? Stop CPR and monitor their condition, right? And that's the biggest thing too. You want to make sure you're staying monitoring that condition until EMS comes and takes over. And it's not when EMS arrives. When EMS arrives, they're first going to be assessing what's going on. So you keep working on the victim until EMS actually taps you out. Anybody have any questions about CPR on adult and children? All right. 2-person CPR, adult and child. That's done when one rescuer is doing ventilations, the other is performing chest compressions. How often should you switch positions? You're going to do that every 2 minutes. So when you're doing compressions on an adult, it's still 30 compressions and 2 breaths. If it's coming up on 2 minutes, you're going to be doing 27, 28, 29, switch. The person who's doing the breaths, they'll do their 2 breaths, and then they will move to the opposite side, begin compressions. And the person that was doing compressions will switch masks, and they'll move to the front so they can take over breathing from there. When CPR is in progress by one rescuer and a second rescuer arrives, the second rescuer should first confirm whether EMS personnel has been summoned. If not, the second rescuer should do so before getting the AED and assisting with care. You always tell someone when you're having call 911, bring back an AED machine. You want to get an AED machine up and running as quickly as possible, because for every minute it takes to get an AED machine up and running, their chance of survival decreases by, I think it's 10%. So make sure you get it up and running as quickly as possible. The difference between 2-person rescuer in CPR with an adult to the children and infant, the compressions of breath are 1 or 15, 30 compressions to 2 breaths for the adult, 15 to 2 for the child or infant. What are the 2 most common treatable abnormal rhythms associated with sudden cardiac arrest? Number 1 is VFib, and then number 2 is ventricular tachycardia. VTAC, that's easier saying than ventricular tachycardia. An AED is a portable electronic device that analyzes the heart rhythms and provides an electrical shock. It's looking for an abnormal heart rhythm to be able to shock the heart so it stops, which will hopefully make it spontaneously restart. Each minute, there we go, each minute that a CPR and defib are delayed, the victim's chance of survival is reduced by about 10%. When cardiac arrest occurs, use an AED as soon as it is ready to use. If the AED advises that a shock is needed, follow the protocols to provide 1 shock followed by about 2 minutes of CPR. If CPR is in progress, do not interrupt chest compressions until the AED is turned on and the AED pads are applied and is ready to analyze the heart rhythm. In other words, if Corey's doing CPR and I come up with the AED pad, while I'm putting the pads on, he's going to continue doing compressions and breaths until we actually say, analyzing the heart rhythm, everyone's standing clear. The funny thing was, we were watching something the other day on TV, my wife and I, and there was an actual AED in progress they were using, just a quick video. And the training AED machines that we use, it's the exact same voice. So she was shocked. She said, wait, it's no different than the toys we have? I'm like, no, it's all the same. So it will tell you exactly what to do. AEDs may be equipped with pediatric pads. However, pediatric pads are appropriate only for use on infants and children up to 8 years old or who weigh less than 55 pounds. Some AED machines actually have keys that you turn from adult to child to pediatric as well. So you just have to kind of be familiar with whatever AED machine you may be using. If pediatric equipment is not available and the local protocols allow, you can use an AED designed for adults. If the AED pads risk touching each other because of smaller chest size, use the front and the back method for back placement. So right here in the front and down in the middle of the back. Again, make sure that they're not in any puddles of water. You don't have on a metal plate, and it does need to be skin to skin. So tops should be down. Make sure it's adhered as close to that skin as possible. Using an AED with CPR in progress. When one rescuer is on the scene, that rescuer begins CPR and instructs someone to summon EMS and obtain the AED if someone is available. I always say, make sure you tell someone specifically. If I'm going to use them with Corey, go call EMS and bring back an AED machine so Corey knows it's him. And if I just say go call EMS, Brody, Trey, and Avery may just be thinking one of the other ones aren't doing it, right? So tell someone specifically. When the assisting rescuer arrives, they prepare the AED for use while the rescuing lifeguard continues CPR. If at any time the rescuer notices an obvious sign of life, such as no breathing, they should stop CPR, monitor the victim's condition, and administer emergency oxygen if it's available and you're trained to do so. None of you will be trained to do so, so don't worry about that. CPR with an airway obstruction. If a victim who is choking becomes unresponsive, you're going to carefully lower them to a firm, flat surface, send someone to get an AED, and summon EMS if you have not already done so. So to me, that looks like a conscious choking victim, I would say. And the other thing I would tell you, if it's a conscious choking victim, all of a sudden becomes unresponsive, you also do want to check for breathing as well, because it is very possible if they become unconscious, maybe something just relaxed their body and whatever was causing that blockage may have dislodged. So you want to make sure you check for breathing also. Once you check for breathing, you're going to begin CPR, starting with chest compressions. As you open the airway to give ventilations, you're going to look in the person's mouth for any visible object. So you're going to grab the bony part of the chin, the fleshy part of the tongue, open. On an adult, you'll do a finger sweep. On a child or infant, you'll do a pinky sweep. If you do not see an object, don't do a blind finger sweep. Try a breath. If the breath doesn't go in, continue the compressions. Multiple rescue response, we'll go through that. So in 2 weeks, we'll go through all the multiple victims. First aid. Secondary assessment. After you completed the primary assessment and determine that there are no life-threatening conditions, perform a secondary assessment to determine if there are any additional non-life-threatening conditions that would require you to provide care. What information should you check for when using the sample to take a brief history related to the illness? Sample stands for signs and symptoms. The A is for allergies. The M is for any medications they may be taking. P is for pertinent past medical history. L is for last oral intake, which would be kind of more with the medicines. And then E are the events leading up to the incident. And really, so for an example, for me, I've used a situation where we had a child fell into a gutter. They bumped their head. We had visualized a bump on the front of their head. And as we were talking to them, we asked her where she hit her head. She had very black hair. She indicated her head, we hit her head on the top of her head. So we took a towel, we placed it on the top of her head, just kind of give her a little bit more peace. When we took the towel off, there was blood on the top. So we could not see the blood because her hair was so black. And we would not have known had we not been doing the sample method. So it's always good if you can talk to the victim, find out what is going on. What should be included? Yes, sample is a test question and method using when doing a secondary assessment. Good job. Thank you, Corey. What should you do? What should be included when performing a secondary assessment? You're visually inspecting the person's body, looking carefully for any bleeding, cuts, bruises, and obvious deformities. You're also looking for a medical identification tag, necklace or bracelet on the person's wrist, neck, or ankle. You see these medical ID tags. They tell you sometimes if they have seizure issues or if they have diabetes. What should be included when performing a secondary assessment? You're going to check the person's ability to move body parts. Caution the person not to move any body parts if they experience discomfort or pain. If the person is unable to move a body part or has experienced dizziness or pain on that movement, make sure you keep them in a resting in a comfortable position. Keep the person from getting chilled or overheated. Always reassure the person, whether they're conscious or not. Always reassure, hey, I'm here to help. You're going to be okay. I've got you. No worries. You're going to be fine. Always make sure you're reassuring them. Determine whether to summon EMS personnel and continue to watch for changes in the level of consciousness, LOC, and breathing. When responding to injuries, make sure if you have bleeding, you're going to work on controlling bleeding. Again, you're using PPE. So your gloves, you're looking for either an abrasion, a laceration, an avulsion, or a puncture. Those would be different open wounds. We will do the skill practice on controlling external bleeding. So we'll use the gauze, we'll use the gauze and the wraps as well. So we'll go over that. Signs and symptoms of shock. These are all these signs and symptoms are pretty much the same for everything really. It's restless or irritability, altered LOC, pale or ashen or cool moist skin, nausea or vomiting, rapid breathing and pulse, excessive thirst. Ways to minimize shock include making sure that EMS has been summoned, monitor the victim's condition, watch for changes in LOC, control any external bleeding, keep the victim from getting chilled or overheated, and have the victim lie flat on their back. First aid scenarios. So if you're a lifeguard on duty in an outdoor pool, a child comes to you saying that they were just in the concession area eating a snack when she was stung by a bee. Their parent is swimming laps in the adult lap pool. The first thing you're going to do is you're going to try to get back up for wherever you are. So if you're on the stand, you want to make sure you get somebody else because you can't get off that stand and then leave the pool unattended. Make sure you get the attention of the child's parent to obtain consent, and then ask if the child has any known allergy to bee stings. Child comes to you saying that they were, we already did that. Signs and symptoms, so you're looking for pain, redness or swelling, possible presence of a stinger, and any signals to an allergic reaction, such as rash or hives, feeling of tightness in the chest and throat, shortness of breath, swelling of the head, neck, or head of the face, neck, or tongue. Different things you'll do to care. You're going to examine the sting site to see if the stinger is in the skin. If it's still present, you're going to remove the stinger by scraping away with the edge of a plastic card, such as a credit card. Wash the wound with soap and water. Cover the site with dressing and keep the wound clean. Apply a cold pack to the site to reduce pain and swelling. Watch the victim for signals of allergic reaction. Monitor their LOC. Keep the victims comfortable and then summon EMS for any life-threatening conditions, such as a breathing emergency. Afterwards, you want to follow up. Make sure you have the child remain in the first aid area for a few minutes. Watch the child for any signs of an allergic reaction. And then make sure you tell the child and a parent to alert a lifeguard or other staff member if the symptoms become worse. Always make sure you're letting that parent know as well. You don't want to leave a child, or you don't want to have a child leaving who's been hurt without telling their parents. If they go home and they find out that they didn't find out that something happened and something worse happens, then you'll be held responsible. So make sure you let the parents know. If you're on a break when an adult tells you that their friend is not feeling well and needs help, the patient tells you that they are wearing a diabetic ID bracelet. First, you're going to obtain consent from the person who is not feeling well. Again, if it's a child, consent is implied if there's not a parent around. You're going to check for signs and symptoms. The patron told you that they are not feeling well. Their medical ID tells you what condition they have. The first thing you're going to do, if the parent or the person is awake and can safely swallow, follow simple commands, give them sugar. If it is available, give them 15 to 20 grams of sugar in the form of glucose tablets. Doubt those are going to be very available for you. If not, you can either do jelly beans, orange juice, or whole milk. All of that will be helpful. Summon EMS personnel if the person is unresponsive. If the person is responsive but not fully awake or is unable to swallow, if you feel like they're going in and out of consciousness, make sure you're summoning EMS. The person does not feel better within 10 to 15 minutes after taking sugar, or they get worse, or form of sugar cannot be found immediately. Do not spend time looking for it. As a follow-up, ask the patient to remain there until they clearly feel better, at least 5 minutes, and then tell the person to alert a lifeguard or staff member if symptoms recur. I would also say if people are diabetics, usually they have stuff with them as well because they're kind of a little bit more aware of what could happen. So find out from them if they have any other medicines or medical advice that they could use. If you are on break in the lifeguard room and through the window, you notice the patron is on deck, appears to be having a seizure. First, obviously activate the EAP. Signs and symptoms: seizures could last for 1 to 3 minutes and can produce a wide range of signs and symptoms. They may lose consciousness and fall. They may become rigid and then experience sudden uncontrollable muscular convulsions lasting several minutes, and the breathing may become irregular and temporarily stop. You're going to summon EMS if the seizure occurs in the water, and you do that immediately. If this is the person's first seizure, if the seizure lasts more than 5 minutes, the person has repeated seizures with no lucid period, the person appears to be injured, the cause of the seizure is unknown, if the person is pregnant, if the person is known to have diabetes, the person fails to regain consciousness after the seizure, or if the person is elderly and may have suffered a stroke. And I would always tell you, if you are unsure, call EMS. You'll never go wrong there, because at least you have that backup. And again, I'll use past examples. We had a parent who she had brain cancer, had half her brain removed, so she was prone to seizures. She had a seizure. The family had indicated that if she has a seizure, just let it go, no big deal. But we didn't feel comfortable with that enough. We made sure to still have EMS arrive. When they got there, they checked her out and made sure that she was okay. We didn't want to just leave it up to chance. For a follow-up, you're going to stay with the person until they're fully conscious and aware of their surroundings. You're going to offer to let the person remain in the first aid area and rest. Care steps include: protect the person from injury by moving nearby objects away from them. Position the person on their side if possible after seizure passes, so that fluids can drain from their mouth, and check to see if the person was injured during the seizure. The other thing is, don't put anything in their mouth, right? You don't, when they're having a seizure, just support them. You don't want to try and stop them or hold them down. You're hosing down a section of the deck, part of your secondary responsibility. As a regular patron approaches, tries to ask you a question, their speech seems impaired and you cannot understand what they're saying, you want to activate the EAP, obtain consent if you are able to do so, and then check for signs and symptoms. So a sudden change in how the body is working or feeling, such as sudden weakness or numbness of the face and arm or of the leg, often only on the side of the body. If there's difficulty with speech, such as trouble with speaking or being understood, difficulty understanding others, blurred or dim vision, sudden severe headache, dizziness or confusion, loss of balance or coordination, trouble walking, and or ringing in the ears. Care steps would be to summon EMS immediately. Think fast. So fast is more you're trying to find out with the face. Ask the person to smile. This will show if there's a drooping or weakness of the muscles on one side of the face. Does one side of the face droop? You're going to check for the arm to see if they can raise both arms to find out if there's weakness in the limbs. Does one drift downward? For their speech, you're going to ask them to speak a simple sentence to listen for slurred or distorted speech, such as, is the sky blue? Can the victim repeat the sentence correctly? Note the time that the signs and symptoms began and summon EMS immediately. Follow up with comfort and reassure the person until EMS arrives. Collect any of the person's belongings and give them to EMS personnel. And then make sure that after you activated the EAP, you're obtaining consent if you can do so. Signs and symptoms include sudden change in how the body is working or feelings, such as sudden weakness or numbness of the face and arm or of the leg, often only on one side of the body. Difficulty with speech, trouble speaking and being understood, and difficulty understanding others. Blurred or dim vision, sudden severe headache, dizziness or confusion, loss of balance or coordination, trouble walking or ringing in the ears. Care steps would be to summon EMS. We already did that. There we go. Scenario 5. You're on duty as a lifeguard. You're stationed on the deck at the shallow end of the pool. An adult is exiting the pool using the ladder that slips. His mouth hits the railing When you approach the victim, you notice that he's missing a tooth. Corey understands that well right now, which he is holding in his hand and bleeding from the mouth. We weren't on it earlier. Corey's son lost a tooth last night. Initial steps, including obtain consent from the patron who's not feeling well. Signs and symptoms, the tooth is missing, they have it in their possession, bleeding from that area. Care steps would be to rinse the victim's mouth with cold tap water if available. Have the victim lean slightly forward or place the victim on their side. Try to prevent the victim from swallowing the blood, which could cause nausea or vomiting. Have the victim bite down on a rolled sterile dressing in the space left by the tooth. Save the displaced tooth. Carefully pick the tooth up by the crown, the white part, not the root. You're going to rinse the tooth off in water. Do not scrub it or remove any attached tissue fragments, and then place it in milk. If milk is not available, place the tooth in clean water and keep it with the victim. Advise the victim to get to a dentist with the tooth as soon as possible. You're on a break and a concession worker comes up and tells you that help is needed. Another concession worker has been burned by hot oil from the popcorn machine. First, obtain consent, then check for the burned area on the arm and red skin and blisters beginning to form. That would be a certain sign. Care steps, stop the burning by removing the person from the source of the burn. Sounds simple enough, but still needs to be done. Cool the burned area with large amounts of cold water or tap water for at least 10 minutes. If cool or cold water is not available, use a cool or cold compress that is clean. Monitor the victim for hypothermia when cooling large burns. Cover the burned area loosely with a sterile dressing. Comfort and reassure the victim. Then you're going to follow up, advise the victim to see a doctor. Head, neck, or spinal injuries. You should suspect a possible head, neck, or spinal injury only if activity was high impact or high risk and the signs and symptoms of an injury are present. Different areas that could have high risk: entering head first into shallow water, entering the water from a height such as a diving board, water slide, embankment, cliff, or tower, striking a submerged or floating object, receiving a blow to the head, colliding with another swimmer, striking the water with high impact such as falling while water skiing or surfing. Signs and symptoms would be unusual bumps, bruises, or depressions on the head, neck, or back. Heavy external bleeding of the head, neck, or back. Bruising of the head, especially around the eyes and behind the ears. Blood or other fluids in the ears or nose. Confusion or disorientation. Changes in the LOC. Seizures, impaired breathing, vision, or nausea and vomiting. Partial or complete loss of movement of any body part. Loss of balance. Behavior that is similar to that of a person under the influence of alcohol and drugs. For example, if they're confusion, stumbling, repeatedly asking the same questions. Memory loss, nausea or vomiting, and speech problems. Severe pain or pressure in the head, neck, or back. Back pain, weakness, tingling, or loss of sensation, or persistent headaches. So that's all we have with that. And that. The last thing we're going to do is I've got a video to show. One of the things to make sure you all understand is becoming lifeguard. It's one of the most important jobs that you can have, and you definitely need to take it seriously. And you need to always make sure that you're vigilant of what you're doing. You're always moving your head. You're always scanning. Things don't always go right. There's always things that could happen. So we're going to show a video of when something goes wrong. I usually show this video each time because I do think it's an important video. The video quality isn't the best, but you'll kind of get the gist.
Taken out into the middle of the pool. He's dumped 12 times very aggressively, which you can see on the video. And instead, on his first day at camp, his parents took him to a summer camp. It was supposed to be a fun and exciting experience. It was promised to be a safe experience. Instead, on his first day at camp, little Yoni drowned. What you are about to see is taken from the security camera at the Cathedral Oaks Athletic Club, where the camp was held. The video contains graphic and disturbing content, and viewer discretion is advised.
Be aware when you look at this, it's a
Short.
4-lane
A
pool, so
great
it's not
color
very big.
circle with the letter C above it will appear around a Cathedral Oaks Athletic Club camp counselor, Sam Shipley. Shipley was in the pool with Yoni Gottesman, and aggressively dunked little Yoni underwater numerous times before he died. A red-colored tracking circle will appear around Yoni. The tracking circles will follow these two throughout the video. COAC counselor Shipley dunks Yoni underwater.
If you look at that right corner near the side, that's where the lifeguard is sitting right now.
COAC counselor Shipley dunks Yoni underwater a second time. COAC counselor Shipley dunks Yoni underwater a third time. COAC counselor Shipley dunks Yoni underwater a fourth time. COAC counselor Shipley dunks Yoni underwater a fifth time. COAC counselor Shipley dunks Yoni underwater a sixth time. COAC counselor Shipley dunks Yoni underwater a seventh time. COAC counselor Shipley dunks Yoni underwater an eighth time. COAC counselor Shipley dunks Yoni underwater a ninth time, this time with another child. COAC counselor Shipley
The lifeguard
dunks
just left
Yoni
the area.
underwater a 10th time, again with the other child. COAC counselor Shipley dunks Yoni underwater an 11th time, again with the other child. The COAC lifeguard on the far side of the pool, David Marin, leaves his station. COAC counselor Shipley dunks Yoni underwater a 12th time,
I can see the
again with
lifeguard
the other
coming back
child.
into the view.
COAC counselor Shipley is surrounded by numerous children, including Yoni. He swims away toward the lane line and they swim after him. COAC counselor Shipley turns around as he gets closer to the deep end, and the children chase him back towards the steps.
And keep in mind that red circle is where Yoni is.
Yoni desperately attempts to reach COAC counselor Shipley, but Shipley continues to dodge the children. After Shipley deserts him, Yoni is unable to make it to the wall. He stops moving approximately 5 feet from the wall and begins to float face down. COAC lifeguard Marin returns to his station. The COAC lifeguard on the near side of the pool, Michael Bowen, leaves his station for approximately 21 seconds to clean off a kickboard.
So pay attention where that lifeguard is and where Yoni's body is. There's about 5 to 8 feet from where he is, and yet he's not yet even seen him. There are other kids that are around Yoni. Yoni is
has been floating face down for
Yoni
1
is
minute.
face down, unconscious at this point for over a minute.
COAC lifeguard Bowen is playing with adjusting the umbrella at his station and not watching the swimmers. COAC lifeguard Bowen turns away from the pool for approximately 16 seconds to adjust the parka jacket on his chair. Yoni has been floating face down for 2 minutes.
Really, when a victim starts becoming submerged and is drowning, you need to get to them within 10 seconds. I mean, they say it can take up to a couple minutes. Really, you need to get to as quickly as possible. The quicker you're there to help that victim out, the quicker you start providing care, the better the chances of their survival. Again, you can see there's kids all around where Yoni is floating.
Yoni has been floating face down for 3 minutes.
The family of Yoni actually has put this on YouTube. They want it to be a learning experience for everybody to see what can happen if you're not paying attention. Again, this is why as a lifeguard support, you're always scanning the pool. Make sure you're watching the top of the pool, the bottom of the pool, the middle of the pool to see what's going on. Make sure you're aware. You can tell, I mean, there's what I would say maybe 10 kids at most of this pool.
Yoni has been floating face down for 4 minutes.
Jump it up 2 minutes here. So 2 minutes more of just advanced.
Yoni has been floating face down for 6 minutes.
6 minutes still, no view. See other adults around.
COAC counselor Shipley plays with children right next to Yoni.
So the initial counselor that was having fun with the kids and really just kind of, I would say innocently playing with them is right next to him and doesn't even still see what's going on. So he's in the water with him. He doesn't see it.
COAC lifeguard Marin leaves his station to get a soda. He does not return until after Yoni is pulled from the pool.
So there's a lifeguard on the left side that we're not able to see, but so there's 2 guards there watching this whole thing and not seeing
Yoni
anything.
has been floating face down for 7 minutes. At the same instant, COAC counselor Shipley dunks a child very near Yoni, but takes no notice of the motionless figure floating in the pool. Children close to Yoni go underwater to look at him, then yell to COAC lifeguard Bowen and counselors. Yoni has been floating face down for 8 minutes.
8 minutes and the kids finally alert somebody, but even still, the guard doesn't react right away.
A female COAC counselor on the pool deck points out Yoni to lifeguard Bowen, who still had not taken any notice of him. COAC lifeguard Bowen jumps in the water. COAC lifeguard Bowen pulls Yoni from the water and places him on the pool deck after Yoni had been floating right in front of him for more than 8 minutes.
And you can see how quick and easy he got to him.
After 3.5 years, Yoni's mother, Anat, still can't bring herself to view the video.
Everyone is out to watch someone destroy.
So while lifeguarding could be one of the most fun jobs you could ever have, I would also tell you it's probably one of the most important jobs you could ever have. So you always do need to make sure that you're constantly being vigilant, being aware, and paying attention to what's going on. We'll go through all sorts of different rescues, saves, entries. We'll make sure you're as prepared as possible, but you still have to make sure you're doing the job on deck, in the stand, and with the patrons, making sure they're safe. Corey, do you have anything? All right, everybody, thank you very much. Remember, 2 weeks, so Saturday, what is that? The 22nd, we'll do the in-person for most of you. Some of you I know will be doing the one later in May, and that's fine as well. But if you're doing the one on Saturday, the 22nd, try to get there 15-20 minutes early because there will be a lot of parking at Ladue due to a track meet. So get there as early as you can. I would tell you to bring something to drink and bring a snack as well, just in case you get hungry later on. Thank you all very much. Enjoy your Easter, and we'll see you all soon. Take care.
Thank
Thank
you.
you.
Thank you.
Thank you. Bye, thank you.
Thanks, Brody. Take care. He's one of the nicest kids, I swear to God.
Are we still recording?
I know, as I'm looking to say, stop recording. There we go. Did I stop?